Okay, so you ready for this? We're going to be diving deep today into Robert F. Kennedy Jr.'s vision for the U.S. Department of Health and Human Services. You know all about RFK Jr., right?
Yeah, of course.
So you sent us some YouTube videos of his remarks to the HHS staff and also some commentary from medical professionals.
Right.
Should be interesting.
It certainly is RFK Jr. He's never been one to shy away from controversy.
Yeah, no kidding.
And his appointment to this position has definitely, stirred up the pot a little bit.
Putting it mildly.
Yeah.
I mean, the guy is calling for like a radical transparency revolution at HHS.
Yeah.
What does that even mean?
Well, he's talking about informed consent and public access to data, really pushing this idea that transparency is the foundation of trust.
Okay.
Both in science and in government.
Okay, I can kind of get that in theory, but how does that actually play out in practice?
Well, that's the million-dollar question, isn't it? It's a very noble goal, but the devil is always in the details.
Right.
And speaking of details, we can't ignore the elephant in the room here, RFK Jr.'s stance on vaccines.
Right, he's been a very vocal critic of vaccines for years, and now he's in charge of the agency that basically oversees vaccine policy for the entire country.
Exactly. And it seems like that skepticism is extending beyond just vaccines as well.
Oh, really?
He's also raising questions about a whole bunch of other things.
Like what?
Antidepressants, electromagnetic radiation, glyphosate, the list goes on and on.
Glyphosate.
Yeah.
What is that? Isn't that the stuff in Roundup?
Yeah.
Like, what's his beef with weed killer?
Well, it's not just about killing weeds. Glyphosate has actually been linked to some pretty serious health concerns, like cancer.
Oh, wow.
It's a very complex issue with a lot of conflicting research.
So is he saying that we should ban Roundup?
Not necessarily, but he is saying that it deserves a closer look.
Okay.
And he has pledged to use the power of his position at HHS to investigate these kinds of controversial issues.
Hold on a sec. I'm starting to see a pattern here. He's taking aim at a lot of things that mainstream science considers to be settled. Vaccines, antidepressants, even things like electromagnetic radiation.
Yeah.
It seems like he's coming at this with a pretty deep-seated skepticism of the scientific establishment.
That's one way to put it, I guess. You could also say that he's championing the need for more rigorous research and independent verification.
Okay.
It all depends on your perspective.
Okay, but that's kind of my point. Like, how do we balance skepticism with, established knowledge? Where do we draw the line between, legitimate concerns and just unfounded fears?
Well, that's the crux of the matter, isn't it?
Well,
and it's going to be very fascinating to see how RFK Jr. navigates this tension as he takes the helm of HHS.
Speaking of navigating, let's talk about his remarks to the HHS staff. He painted a pretty grim picture of American health, didn't he?
He did.
Called it a chronic disease epidemic.
Yeah, he cited some very alarming statistics.
Like what?
Like the fact that 6 out of 10 adults in the U.S. have at least one chronic disease.
Wow.
And 4 out of 10 have 2 or more. He even compared the U.S. to other developed countries, claiming that we have the highest age-standardized cancer incident rate among 204 countries.
Really?
Yeah.
Those are some pretty heavy stats.
Yeah.
What does he attribute this epidemic to?
Well, he points to several factors. The rise in autism, fatty liver disease, diabetes, and obesity in children. He even mentions a decline in sperm counts and testosterone levels in boys and early puberty in girls.
Wow, that's a lot to unpack.
Yeah.
It sounds like he's saying there's something fundamentally wrong with the way that we approach health in this country.
It certainly seems that way. He seems to be building a case that something has gone awry.
Okay.
And he seems to be pointing the finger at a system that he believes prioritizes profit over people.
And he specifically calls out the influence of pharmaceutical companies, right?
Absolutely.
He's been pretty critical of big pharma in the past.
He has. He believes that the pharmaceutical industry has too much power and influence over healthcare policy. He's also concerned about the role of money in politics.
Okay.
Arguing that it leads to the politicization of health issues.
It's interesting, though, because while he's critical of the system, he seems to have a lot of respect for the people that are actually working within it.
Yeah.
He specifically praised the HHS workforce, calling them idealistic and committed to public service.
That's a really good observation. He seems to be drawing a distinction between the individuals who are genuinely trying to make a difference,
right,
and the system itself, which he sees as corrupt and broken.
Okay, so we've talked about the problems that he's identified. What are the solutions besides this radical transparency thing?
Well, he's pledged to launch a series of investigations into some pretty hot-button issues.
Okay.
And he's made it very clear that nothing is off limits.
What does that mean exactly?
Well, he specifically mentioned the childhood vaccine schedule, antidepressants, electromagnetic radiation, glyphosate, ultra-processed foods, artificial food additives. It's a very extensive list.
So it sounds like he's not just calling for transparency. He's actually planning to use the power of HHS to challenge some very deeply entrenched beliefs and practices.
Yeah, I think so.
Wow. It's almost like he's like throwing down the gauntlet, right?
Yeah.
Daring people to like question everything they thought they knew about health.
And that's exactly what is making a lot of people so nervous. Some medical professionals are already kind of pushing back pretty hard on this. We actually have a clip from an interview with Dr. Sasha Hamdani.
Okay.
She's a psychiatrist, and she directly refutes some of RFK Jr.'s claims about antidepressants,
Oh, yeah.
particularly SSRIs.
Right. He said something pretty inflammatory about SSRIs being like more addictive than heroin.
Right. Which Dr. Hamdani says is just flat out wrong.
Okay.
She explains that while SSRIs can have withdrawal symptoms, they're not addictive in the same way that heroin is.
Okay.
And she really stresses that they can be extremely effective for a lot of people when used appropriately.
It sounds like we're going to be hearing a lot of back and forth between RFK Jr. and the medical establishment.
Oh, I think that's a safe bet. And it'll be interesting to see how the public reacts to all of this, because a lot of people are already skeptical of conventional medicine and big pharma.
True.
You know?
Yeah. RFK Jr. seems to be tapping into that sentiment a little bit.
He is. He's really positioning himself as a champion for the people,
Right.
fighting against these powerful interests that he believes are putting profits ahead of public health.
Which is a pretty powerful narrative.
It is.
Especially in today's climate.
Yeah, people are really hungry for authenticity, for someone who's not afraid to speak truth to power.
But the question is, whose truth are we talking about?
Yeah.
And what happens when those truths conflict with, scientific consensus?
Well, that's a question we're going to have to grapple with as RFK Jr.'s agenda unfolds. But for now, why don't we dive into some of the specific issues that he's targeting?
Okay.
We've talked a bit about vaccines and antidepressants. What about this whole electromagnetic radiation thing?
Yeah, that one's a little bit of a head-scratcher for me. What exactly is he concerned about?
Well, there's been a lot of debate about the potential health effects of exposure to things like cell phones, Wi-Fi power lines, basically anything that emits electromagnetic radiation.
Right, I've heard about that.
Mhm.
But isn't the jury still out on, whether there's any real risk?
For the most part, yes. Some studies have suggested possible links to certain cancers,
Okay.
but the evidence is far from conclusive.
So why is RFK Jr. making it such a big deal?
Well, he seems to be subscribing to this thing called the precautionary principle.
Oh, okay.
Basically the idea that if there's even a small chance that something could be harmful, we should err on the side of caution.
Okay, I see. But that can be a slippery slope, can't it? I mean, if we apply that logic to everything, we'd never leave the house.
That's a valid point. It's all about finding the right balance,
Yeah.
between managing risk and not letting fear paralyze us.
Okay, what about glyphosate? We talked about that a little bit earlier.
Yeah.
Is he seriously suggesting that we ban Roundup?
It's hard to say for sure. He hasn't explicitly called for a ban, but he has said that he wants to investigate its safety and its potential long-term health effects.
Which makes sense. I mean, it is a
Yeah.
pretty widely used herbicide.
Yeah.
And if there's evidence that it's harmful, that's something we need to know about.
Exactly. And that's where his call for transparency could be really beneficial.
Right.
If we can get all the data out in the open and have a public conversation about the risks and the benefits, then people can make informed decisions.
What about ultra-processed foods and artificial food additives? Those are on his hit list too, right?
They are. And to be honest, I think there's less controversy surrounding those.
Really?
I mean, most people would agree that a diet that's heavy in processed foods and artificial ingredients isn't exactly a recipe for good health.
Right, but that doesn't mean we need the government to step in and tell us what to eat.
Right. It's a very tricky balance between personal responsibility and public health. But RFK Jr. seems to be suggesting that we need to take a more systemic approach to food policy. He's talking about tackling things like food deserts and regulating marketing practices and making healthy food more affordable.
Those are all valid points. But they're also incredibly complex issues that are going to require a lot more than just investigations.
Absolutely. It's going to take a very multifaceted approach involving policymakers and educators and community leaders and individuals making conscious choices about their health.
So to circle back to where we started, it seems like RFK Jr. is really shaking things up at HHS. He's challenging conventional wisdom, raising these uncomfortable questions and demanding a level of transparency that we really haven't seen before.
And that's bound to ruffle some feathers,
Yeah.
especially among those who benefit from the status quo.
Right.
But it's also generating a lot of excitement and hope among people who feel like their voices haven't been heard.
It's almost like he's capping into this really deep-seated desire for change.
Right.
Like we need a different way of doing things.
And that's what makes all of this so fascinating.
Yeah.
Because whether you agree with him or not, there's no denying that RFK Jr. is forcing us to confront some very fundamental questions about health and science and the role of government in our lives.
And then there's that whole spiritual malaise thing. That's not something you typically hear a health secretary talking about.
I know, right? It's definitely a very unconventional perspective.
Yeah.
He's basically saying that this sense of alienation and hopelessness that a lot of people are feeling is contributing to our poor health.
So it's not just about our physical well-being.
No.
It's about our mental and emotional state as well.
Exactly. And he's suggesting that maybe, just maybe, part of the solution to our health crisis lies in addressing this deeper spiritual malaise.
Which is a pretty radical idea when you think about it. It's challenging the traditional boundaries of healthcare
Yeah.
and suggesting that maybe we need to think more holistically about what it means to be healthy.
And that's what's so intriguing about RFK Jr.'s vision. It's not just about tweaking policies or funding more research.
Right.
It's about shifting our entire paradigm of health and well-being.
It's a bold vision for sure. But the question is, can he actually pull it off?
Only time will tell. But one thing is for certain, it's going to be a wild ride.
Okay, so we've gone pretty deep into RFK Jr.'s vision for HHS, his push for radical transparency, his concerns about this so-called chronic disease epidemic, his plans to investigate, everything from vaccines to ultra-processed foods, and even this, really thought-provoking idea about the spiritual dimension to, our national health.
Yeah, it's been quite a whirlwind, hasn't it?
Absolutely. I feel like we've only just, scratched the surface. But it's pretty clear that RFK Jr. is bringing a very different perspective to this role. And he's not afraid to shake things up.
Not at all. And that's both really exciting and a little bit unnerving, isn't it? He's challenging some pretty deeply held beliefs and practices. And he's doing it at a time when trust in institutions, including scientific and governmental ones, is already pretty low.
Yeah, that's what makes all of this so fascinating. Because he's kind of walking a tightrope. On the one hand, he's tapping into this very real sense of skepticism and distrust that a lot of people are feeling.
Right.
But on the other hand, he risks further erosion of that trust if his investigations don't turn up anything concrete or if they're perceived as being driven by ideology rather than science.
It's a very delicate balance for sure, and one that's going to require a lot of nuance and careful consideration.
Yeah.
He can't just throw bombs and expect everyone to fall in line.
Right.
He's going to have to build consensus and present compelling evidence and make a strong case for why these investigations are necessary.
And even if he does all of that, there's no guarantee that it'll be enough to convince everybody.
Of course not. But that's okay. Disagreement and debate are actually very healthy.
Yeah.
They force us to think critically and examine our own biases and engage in constructive dialogue. And ultimately, that's what progress is all about.
So as we wrap up this deep dive, what's the one big takeaway you think our listeners should walk away with?
I think the most important thing to remember here is that RFK Jr.'s vision for HHS is a work in progress.
Yeah.
It's a very bold and ambitious undertaking, and it's still way too early to say what the ultimate impact will be, but it's definitely a conversation worth having.
Right.
And it's one that's going to continue to unfold in the months and years to come.
Absolutely. And as always, we'll be here to help you navigate all the complexities and make sense of it all.
Yeah.
So stay curious, stay informed, and stay tuned.